Did she also kind of talk to you about that Neulasta injection that I'm going to stick on you?
Yes.
Just a little bit. I have a lovely little video that I'm going to make you watch later.
Okay.
And then also you're going to get one more shot today, the Zoladex.
For the hormones?
Yeah.
Did she tell you about that one?
Yeah.
Okay.
So does that go in my...
So that is actually an injection.
Okay.
And so I'll give it to you just, when pharmacy brings it. Usually we give it in the abdomen area.
Well,
I've had plenty of those recently.
But I'll give you the Ativan first, so you won't even. So the biggest side effect that you see with these drugs is going to be the nausea. The doxorubicin is red in color, and so as soon as I start giving it to you and you go pee, your urine's going to be a lovely orange pink color. So it's okay, it's not blood, it's just you're peeing out the doxorubicin.
Right.
So that usually startles people when they first go to the bathroom. That can typically... Another thing that we see, besides the nausea, is you can have issues with mouth sores. And that's anything from, actually having a sore in your mouth to just having redness in the back of your throat or having a sore throat. And that can even constitute as mouth sores. This drug, the drugs can also cause her counts to drop, and what I mean by that is her red blood cells, her white blood cells, her platelets. And so a lot of times when these counts are dropping, that is what's causing the mouth sores, is the lowering of the counts. You might feel a little fatigued afterwards. So, just kind of if you feel like doing something, then do it. If you don't feel like doing something, then don't do it. That's usually my best advice to patients. They say, can I still do this? Can I still do that? Whatever you feel.
she needs to stay hydrated though, correct?
Yes, I would, you need to try to drink as much water as you can, and that's just basically helping to flush your kidneys out. Did she also tell you about losing your hair? Did she talk to you about that? Okay, so usually you'll start to notice even after the first treatment, after today, you might wake up a couple days down the road and you might notice some hair on your pillow, or after you take a shower and brush your hair. The only thing that, we tell patients that chemotherapy is going to be in your body for up to 3 to 4 days afterwards. And so chemotherapy is basically excreted in all of her secretions. So that means if she vomits, it's in her vomit. If she's having diarrhea, it's in her diarrhea. It's
Sweat.
It's in her sweat. And so if you say you get sick in the bed, just people that are helping you just need to know that it's in all your secretions, but that typically goes away about 3 to 4 days after chemo.
So should we wear gloves?
I would wear gloves. It's also chemotherapy is also in vaginal secretions. So if you're going to have sex, you need to have your partner wear a condom, or okay.
What are the side effects? I mean, is there anything that we as caregivers should be looking out for us? Like if
So say, it was to, say she vomits and it was to get on your hand or something, you might just have some burning, itching sensation, just kind of where it was at. And then, there's always a risk, even with us healthcare providers, that you're going to absorb the chemotherapy through your skin.
Okay.
Sorry, dear. I'm going to put some saline in here. But just, do the double flushing, wear gloves if you need to.
So we don't need to call y'all if we get it on us. It'll just pass.
Just wash whatever area.
Okay.
You may have
I verified the Ativan. I'll go back in a minute and look for it.
Just wash whatever area with some warm water and some soap, and it'll be fine.
Okay. Great. So you're gonna go ahead and give her some nausea medicine.
So I have 3 different anti-nausea medicines. One is a drug called Aloxi that typically stays in the body for about 36 hours, so that's a good one. I'm gonna give you dexamethasone, which is a steroid, and I'm gonna give you another drug, but that's called a mint. So those are all 3 anti-nausea medicines, and then I'll give you the Ativan. Those are all really, really good medicines that will help control any kind of nausea that she is to have today. Chemotherapy is what we consider cumulative. So the more that you get, the more potential you have to have these reactions, or to have these, side effects. So you may not have anything with cycle 1 or cycle 2, but when we get to cycle 3, cycle 4, you might just start feeling more nauseous or more tired. So my best advice to you is just go ahead and take those anti-nausea medicines. That'll help with the nausea. Take something to keep your bowels moving, drink a lot of fluid. Has a nutritionist come in and talk to you?
Supposed to today.
Okay. That's another thing that we see sometimes with patients with chemotherapy is the loss of appetite. And that's just simply because the chemotherapy can affect your taste buds. And so a lot of times patients will say that food just tastes like cardboard. It just doesn't have much of a taste to it. So our nutritionists are really good. They'll give you lots of tips on kind of how to fight through that, and they're how can I say? So typically, so she's got to get the adriamycin and the Cytoxan for at least 4 cycles. And then once that is completed, then we go to the Taxol. So that's a different chemo, but you're not going to get that yet, basically. So we don't have to do the steroids just yet, except for what we give you as a pre-med for nausea.
And what do the steroids do? I mean, what's their purpose?
So they actually work together with the other anti-nausea medicines to help with nausea.
Okay.
So it sounds kind of weird, but they
Gives it a boost.
They work very well so she's not sick to her stomach.
And then in the future, so I can relay this to her family. We're gonna all kind of take turns. How long will her treatments last, do you think, in the future?
So the actual treatment itself is going to be about 2.5 hours. The only issue is that makes the day longer is every time she comes in, we have to draw labs on her to make sure that her counts haven't dropped too low that we can't give her chemo. So all right, so I'm just waiting on them to get your chemo ready. I see the little stop signs on there, which just simply means that they're still mixing it. And then I'm just waiting on that injection. Okay. All right, ladies, do you have any questions for me?
I think so. Thank you.
You're welcome. You might start now. I can kind of tell your eyes are kind of
That, and she just so y'all are aware, she has very strong reactions. It takes very little of medicine for her to completely be a zombie.
Okay.
So
That's okay.
So I have to tell
I might just sleep through this whole thing, which is okay. I'll get you a wheelchair and we'll take you out that way so you don't have to walk, okay? But yeah, the Ativan's probably gonna make you really, really sleepy, but it just kind of helps calm you down and it helps calm your stomach down.
Yeah.
That's when you get those butterflies and it does work really well to help calm that down. Do you want me to go ahead and just turn the light off and let you just kind of lean back?
I'm ready to go to sleep.
Yeah, you just don't fight it. If you want to go to sleep, you just close your eyes and go to sleep. But I can tell you're.
Yeah.
That's okay. I'll just turn the light off.
Okay.
Let you kind of get some rest. That's going to take 20 minutes for that anti-nausea medicine to go in. So when that's done, I can get your chemo started. Okay.
Alright.
You'll notice I'm going to wear a blue gown, and that's just simply so it doesn't. If it splashes on me, I don't absorb it. And we always have 2 nurses that check chemotherapy. So you'll see one of my colleagues come in, okay? All right, ladies.
Thank you.
I will be back shortly.
Thank you.
I know.
first chemo treatment. Hi. Sorry, I'm Snapchatting.
Okay.
I'm here for my first chemo treatment right now. This week has been crazy. I was actually gonna call y'all and come over last night, but I forgot. But I'm really, really sleepy, so I will call y'all later. But it's going good.